Hi everyone, and thanks for watching. It's been quite a while since I've done an update video, and I just wanted to pop back in and try to get started on updating about my life with Ehlers-Danlos syndrome. For those of you who are new, thanks for tuning in. My name is Dylan. I am from the Chicago suburbs, and in March of 2020, I had a rare and controversial surgery called pudendal nerve decompression surgery. After 7 long years of neuropathic pelvic pain to treat pudendal neuralgia. Pudendal neuralgia is the pain in the main nerve of the pelvis. The pudendal nerve arises from sacral nerve roots S2, 3, and 4, and it affects pelvic floor function, it affects bladder, it affects rectum, it affects the vagina. And it is a very taboo and almost shameful topic to talk about in terms of chronic pain. And it is a lot of times a disease that people suffer in silence. The most common type of pudendal nerve entrapments include people who have gone through childbirth, somebody who has undergone like traumatic injury, or who are avid cyclists. However, mine seemed to arise somewhat out of nowhere, although I had insidious issues since I was a child with pain, very confusing, very multifaceted issues. After my surgery, about 8 months post-op, I'm not really quite sure, in October of 2020, I discovered that I also have a vascular compression syndrome called May-Turner syndrome. That's yet another thing that involves the left iliac vein being compressed by the right iliac artery on the left side of my body. And I had a couple of other vascular compression issues, pelvic congestion syndrome, which is the ovarian veins have insufficient blood flow. And I also discovered that I have moderate nutcracker syndrome, which is the kidney vein being compressed by the aorta and the superior mesenteric artery. So they call it nutcracker syndrome because there's basically a vein being squashed by 2 other vessels. And ever since then, it's been a long journey. I had a stent placed in my iliac vein on the left side that I have to live with the rest of my life. It was basically just sort of a let's see how this helps, if it affects you, because sometimes these vascular compression issues can cause a lot of neuropathic pain. And I am doing, like, overall since pre-surgery, I want to say, like, some days I do feel like I am doing better than pre-surgery, but then other times I feel like I'm doing a whole lot worse. I still really struggle with neuropathic pain episodes. I have stinging, stabbing, shooting, all throughout my left side of my pelvis, and it affects the whole left side of my body. And sometimes it goes up into my arm and my upper body. It affects the central nervous system. Upon discovering my vascular compressions, I also had struggled a lot with eating issues, gastrointestinal issues, dysautonomia. I had fainting spells, all throughout childhood. Could never explain why. A lot of other bizarre symptoms, like my jaw would click, and I had really extremely bad joint pain here and there that I never could verbalize. And so after my vascular compression were discovered, I came to the conclusion on my own and with the agreement of 2 of my other physicians that I have Ehlers-Danlos syndrome, which is a connective tissue disorder. And basically all of the collagen in your body it's all between your organs. It makes up skin and blood vessels. And it's a genetic condition that makes the collagen hypermobile. So basically there are joints in my body that want to move in ways that are inappropriate, that they shouldn't be moving, and thus causing very weird injuries and excessive bruising, heart palpitations, my vessels get pulled in ways they shouldn't, and things like that. So I've been in physical therapy for the greater part of 7 years, and they've discovered a wide variety of issues. I have a couple of problem spots, mostly in my left renal vein area. Lower left abdominal pain has been an issue, and my iliac veins have been issues even prior to any surgery I had. My EDS diagnosis is another talk show, but I just wanted to give like kind of an update on what I'm up to recently. If you're curious on my EDS diagnosis, that's a whole nother video that I can go into on how that came to be. So these days, I've actually been going through some personal issues. I've been going through a divorce for the past year and a half. I haven't really talked a whole lot about it, but I am losing health insurance in the next 6 months. So, and then the other part of it is I am actually back and forth in between Illinois and Austin. So when I am back in the Chicago suburbs, I try to do as many doctor's appointments as I possibly can and physical therapists. I've seen my vascular doctor. I've seen a new pain management doctor who knows EDS, and he knows the issues that come with EDS. And so this time I discovered he wanted a more recent MRI. So I went ahead and did another lumbar MRI in which I discovered that I have facet arthritis and foraminal stenosis in L1 and L5. I went for 7 years thinking I never had any back issues. However, that's an area that I had yet to explore. My pain management doctor thinks that the best route for me dealing with my neuropathic pain is to consider a spinal cord stimulator. So these are little devices that get surgically implanted with leads. The leads connect to your spinal cord, and they basically shut down or distract nerves that may be involved in pain. It's basically an internal TENS unit. There's a lot of different brands of spinal cord stimulators out there. There's a lot of different areas that they can place these leads. So my new pain management doctor wanted to go that route, and he wanted to place a stim unit, but he wanted to do more steroid injections to figure out the best placement for the stim unit. Now, I am not yet 2 years post-op from my decompression surgery, so I opted to wait to do anything more invasive like that. I'm kind of done with doing injections. I've had at least 5 or 6 different steroid injections throughout my life, trying to figure out how to turn off these nerves, none of which have been long-term successful or done any good for me. So, and they were mostly for diagnostic purposes, not necessarily for treatment purposes. So that's something to consider down the road once I'm on a new insurance plan. When I'm in Austin, I do have a new pelvic floor physical therapist who is knowledgeable about hypermobility disorders. So the conclusion that I've kind of come to in the last several months is that I'm sort of done with doctors. They don't think that my compressions or any of my symptoms or anything that shows up on my MRIs is serious enough to do anything about, with the exception of the spinal cord stim, which can be addressed at a later date. So my direction now is I really, really want to get involved in genetic research. I think it is super important for people with hypermobility spectrum disorders and connective tissue disorders and any type of rare disease for that matter to get sequenced and donate your DNA to research programs so that we can change the standard of testing, because currently there is no good way to test for any of these diseases. It is not the standard for doctors to go to your genetic testing. So I think my goal in life and my purpose in life now is to try to fight for changing the standard of testing for rare diseases, because I've been through the gamut the last 7 years. I've chased a lot of dead ends. I've fought with doctors, I've cried with doctors, and I am not unique. I am not the only person out there that is dealing with this crap. The medical system is designed for things that they can solve and that they can give a pill to and be done with, or fix or treat with some kind of treatment. And there are so many people that fall through the cracks. And I think my life purpose is to do everything in my power to make sure that nobody falls through the cracks the way that I did and the way that so many other people did. So I feel like I owe it to the people that have EDS that do not have that have it more severe than I do, because on the outside I look like a normal person. I can walk for the most part. I do need a cane sometimes to kind of balance because I do get tired very easily. The chronic fatigue has gotten so bad for me. I have eating issues as well. I can't really digest a lot of solid food at one time, or else I get nauseous. I get headaches and car sick really easily. Since my nervous system is so ramped up, I do have noise sensitivity, and I have sensitivity to like light and sound and everything like that. So I don't have as severe type of connective tissue disorder as some of these other people I met. I am very involved in the Ehlers-Danlos Society support groups and local support groups in both Chicago and Austin. And I think that I owe it to the people who cannot fight, who are bedridden, who have to live in a dark room with lights off all the time, to donate my DNA for science. So that's exactly what I'm doing. I paid quite a significant amount of money to have my whole genome sequenced. So I'm waiting on test results. It's probably going to take up to 2 months to get my results. They test for about 5,000 different rare diseases, and I may discover that something else might show up that I didn't think of. I may have a metabolic disorder because I have so much issues with eating or food or whatever. So genomic sequencing is the direction that I want to go. I am taking a break with doctors. The only treatment that's really helped me personally deal with my connective tissue disorders is physical therapy. They're super good with get a physical therapist who can do visceral work. It is all external manipulation. They see where the tension is in your body, and they go and they release that tension manually. It is amazing. It gives me several hours of relief, but unfortunately then my symptoms return. Get yourself a massage therapist that knows myofascial release, which is basically manipulating the connective tissue in between your organs to release the tension. So that's pretty much what I'm up to these days. I'm, with balancing my personal life, I'm going through a transition right now. I am legally divorcing from my husband. Love him to pieces, but we just have realized that we are better off legally separated. And, I'm as happy as I can be with the cards that I was dealt. And I am super lucky to have an amazing support system. I have an amazing job that I can work remotely. I am still waiting on disability. I've been calling, playing phone tag. Some people get approved very quickly. The system does not recognize connective tissue disorder as an issue. They see it as parts of the body, so back issues, leg issues, whatever else. So I do have new evidence, and I am trying to get some form of Social Security disability because I cannot work a 40-hour-a-week job. Even if it is a remote job, I still cannot work that long because I am constantly switching positions. I have to adjust between sitting, standing, laying. I can only sit for maybe 10 minutes at a time without my nerve pain shooting through the roof. So I have to be very careful about sitting. I do travel, so, and that's more for my mental health than it is. So I'm very fortunate to be able to travel because many people with my condition cannot travel. I do have to have a lot of assistance at the airport. The people at the airport are phenomenal. They wheel me around so I don't have to walk for far distances. And, so life is good. Life is okay. So I am ending with doctors for the time being. I may pick up on that again once I get a different insurance plan. But for now, I may decide to simply pay out of pocket for physical therapists and massage therapists to manage my pain because my pain is all encompassing. It's not just neuropathic pain. It's chronic fatigue. It is nauseousness, it is gastrointestinal, it is abdominal, it is leg pain, it is joint pain, it is everything. So these disorders are very multifaceted. So thank you for listening to me yak for close to 15 minutes on my update. And thanks for being patient and keeping up with my medical journey. When it comes to my pudendal decompression surgery, I sort of regret doing it. Had I known about connective tissue disorders, I probably would have opted to not do the surgery and try a different form of treatment prior to doing that. I may have eventually done the surgery, but I think knowing what I know now, going back, if I could go back, I would not have had the surgery. But alas, I cannot go back in time. I'm doing the best I can with what I have, and that's pretty much it for me. I am leaving to go to Austin, Texas on May 1st, and I am returning on July 10th back to the Chicago suburbs. So I will check in with you guys later, and thanks so much for watching.